My name is Dr. Winston. I'm an academic in health policy and healthcare management. I was diagnosed with prostate cancer at age 61. I did not have any symptoms, but my prostate test, which is a PSA blood test, showed an increase of 0.8 micrograms over the previous year. With my family history of prostate cancer, my race and my age, I felt that this spike should be investigated further. So even though my PSA test showed that my readings were 4.49 micrograms per liter, I felt that I needed to do further action. And the action I took was to ask my family physician to refer me to a urologist. This was done, but the urologist didn't think that I needed any further investigation. He felt that I was overly consumed with nothing. I attended an information session at Princess Margaret Hospital, and this session was conducted by a radiation oncologist and a surgeon, and they were supported by men who had been treated for prostate cancer. After the session, I had a one-on-one conversation with a radiation oncologist who agreed that my situation needed further investigation. Seeing that the urologist wasn't interested in my case, I asked my family physician to make a referral to the radiation oncologist at Princess Margaret Cancer Center, which he did, and the radiation oncologist carried out a thorough investigation of my urinary system. After the thorough examination of my urinary system, it was decided that I should have a biopsy. This biopsy was done, and it was found that I had cancer cells in the biopsy. My Gleason score was 6 out of 10, and the overall classification was T1C, which means that I was in the early stages of prostate cancer. I chose to have brachytherapy, which is the insertion of radioactive seeds directly into the prostate to kill the cancer cells. It's a day procedure lasting about 2 hours under general anesthesia. So I was discharged home once I was able to demonstrate that I could pee without a catheter. There were no long-term complications from my treatment. But one thing for which I was not prepared was the fact that for a number of weeks after the procedure, I had to urinate fairly frequently. Another thing that I got caught up in is that I had incontinence for a number of weeks, and I had to prepare for that by wearing the appropriate protective underwear. I've been taking a drug from the class of medication which is an alpha blocker. These drugs are to help the prostate relax and the muscles at the base of the bladder so that urination can occur. Now, this is not unusual for a man of my age. The issue is that I now have what is called an enlarged prostate, not necessarily due to the procedure. It's a natural thing that happens to men. By age 70, a man can expect that his prostate has increased in size, twice the size of what it would have been for a younger person. During my recovery, I thought about the fact that I didn't think I knew enough about prostate cancer and the treatments which are available in spite of my healthcare background. And I thought there must be many men out there who suffer from the same lack of information. Well, one of the positive outcomes from this experience has been the formation of the Walnut Foundation in 2007. I felt that men needed an organization to assist them in getting good health information and making them responsible for their own health. I got some good support later on from someone who had been treated for prostate cancer and to whom I was providing support. To improve my ability to be supportive of others, I have done a lot of conferences, been as a participant. I've also done a lot of reading, a lot of research, so that my information would be current. I tend to share my information so that I could feel that I'm better prepared to deal with other people, so I get input from others. And more recently, I have been trained as a peer navigator to assist men with prostate cancer and their families so that they could really understand the disease and the supports that are available to them. And on reflection, I wish that I had a better understanding of the whole process, because from diagnosis to treatment, it took 6 months. It felt like a long 6 months, but it doesn't mean that nothing was being done in that period of time. I had investigations to measure my prostate. I had blood tests to make sure that I was healthy. There were no infections. I had cystoscopy to make sure that the passage in my urinary tract was fine. But it just felt a long 6 months. Prostate health screening is a very important part of men's health. It gives an idea of whether or not there's anything wrong with the prostate. If there's something wrong, it's good to find out early, which means that if there's a need for treatment, treatment can be done early before any permanent damage is done. A diagnosis of prostate cancer does not have to be a death sentence. We need to get screened. We need to deal with the issue if it comes up. The earlier we get screened, the better chances we have for getting the treatment that would provide a cure. Prostate cancer can be cured.